This is the model of diaphragm or the diaphragm, which lies in between the thoracic cavity and the abdominal cavity. It is the principal muscle of respiration. Lung is the principal organ of respiration, whereas the diaphragm is the principal muscle of respiration. Today we will discuss its origin, insertion, major and the minor opening, development, relation, the nerve supply, blood supply, clinical significance, lymphatic drainage, all these. So first come to the origin and insertion. First, I want to ask you one question, that how many diaphragm we have? From above downward, that is in the cranial cavity, there is diaphragma celli, which lies above the pituitary gland, which is pierced by the sella turcica. Okay, and then after the all the tentorium cerebelli, these are all diaphragms which separate the two cavities. Then afterwards, in the floor of the mouth, there is a diaphragma oris, which is formed by the mylohyoid muscle. Then come to the neck, the cervical diaphragm, which is formed by the Simpson fossa or suprapleural membrane, which is just above the apex of the lung. Apex of the lung is above the level of the clavicle, 2.5 centimeter above. So the cervical diaphragm. Then comes the diaphragm, that is the abdominothoracic diaphragm, in between the thoracic cavity and the abdominal cavity. Then below in the pelvic cavity there are two diaphragms, that is the urogenital diaphragm anteriorly and then pelvic diaphragm. Urogenital diaphragm is formed by the sphincter urethrae muscle and the deep transverse perineum, whereas the urogenital diaphragm is formed by the levator ani and the coccygeus muscle. So these are all diaphragm. Now come to the diaphragm, the origin. Here you can see the whole of the diaphragm. This is the posterior aspect, this is the anterior aspect from above, which we can see from if we are standing within the thoracic cavity, what we are looking at is this. And if we are inside the abdominal cavity, this is the structure. I have made only one side, okay, only one side. Okay, now come to the origin and insertion. The black color, this one leaf like, this is the central tendon of the diaphragm, which is nothing but the point of insertion, and the muscles takes origin from the periphery. From the Giphisternum, one slip in the green color is going to the central tendon of diaphragm where it get inserted. Then from the costal cartilage, 7, 8, 9, 10. Costal cartilages, you can see from above also. One thing I would like to mention, that this central tendon of diaphragm is not centrally located. It is anteriorly, somewhat anteriorly located. And this is the Giphisternum, and this, the muscle takes origin and get inserted here. Now, these are the costal cartilages, 7 at the Giphisternal junction. This is 7, then 8, then 9, and then here is the, this one is the 10th. Okay, now from here the costal cartilage, the one slip is started and inserted over there. Slip is started, then inserted from the costal cartilage. Okay, 7, 8, 9, 10. And then if we come posteriorly, the 11th and 12th, again one slip is going above and get inserted. This green color Here is the 11th and 12th. 11th and 12th rib. From here also one slip is going in green color. Okay. Now we can see from underneath that what we are seeing. Let's look at here. This 7, 8, 9, 10, 11, 12. Now this is the lateral arcuate ligament and this is the medial arcuate ligament in green color. And this is the, in orange color, this is the right crus. This is the left crus. Right crus is situated on the anterior surface of, in black color, these are the vertebra, body of vertebra. So L1, then L2, then L3. Right crus is extending from the L1 to L3, whereas the left crus is restricted up to the L1 and L2. Okay. From here it has gone above, but there is one from the right crus, one sling of the muscle is encircling the esophagus. That's why which acts as a functional sphincter for that. And this is the left crus. By in some part is encircling and some part is inserting over the central tendon. Here is the left crus. It starts from here and then get inserted over there. This is the medial arcuate ligament which extends from the L2 vertebra and then going up to the L1 transverse process. And the lateral arcuate ligament from the L1 transverse process to the T12 rib. The 12th rib, 12th rib. So medial arcuate ligament from the L2, here is the green one. It starts from here and coming from here up to here. So L2 to the L1 transverse process and then from L1 to transverse process to the 12th rib. This is the lateral arcuate ligament. From here also one slip is started and taking insertion over there. And this is the trifoliate. 3 leaves are emerging out. One is anteriorly and 2 is posterolaterally. What we are seeing in the right side, in the central tendon, this is the caval opening from where the inferior vena cava, and this one is the, here is, you can see, this is the right phrenic nerve. Right phrenic nerve along with the inferior vena cava is coming out, and the opening of the caval opening is square. This one is a square, and this is the, in red color, this is the aortic opening. And one thing I have forgot to mention, that is this is the median arcuate ligament. This one is the median arcuate ligament which is encircling the aortic opening. From here one slip is also going in blue color. This one is from the median arcuate ligament which is encircling the aorta. And from here also some slips are inserting into the central tendon. Okay. Now about the major opening, there are 3 opening, that is at the 8th level, 10th level and the 12th level. At T8, T10 and T12. At the T8, this is inferior vena cava, T10 is the esophagus and T12 is the aorta. With the inferior vena cava, this I have shown, this is the right phrenic nerve, and the left phrenic nerve do not follow this path and coming from thoracic to abdominal through the separate passage. Okay, and this is the, at T10 level, this is the oesophageal opening through which esophagus is coming out. This is oval, the opening is oval, and along with this is the right gastric nerve, And here in yellow color, this is the left gastric nerve, along with the left gastric vessels are coming out through this aperture also only. Okay, and this is the aortic opening through which this is the azygous vein, and this one, this thing, this is the thoracic duct. Thoracic duct along with the azygous vein is also coming from the aortic opening, which is coming out through the aponeurotic. This is round. This opening is round. Aponeurotic opening from the aponeurosis of the median umbilical ligament. It is circling over there. Okay. So if we progress from anterior to posterior, the openings are the inferior vena cava, then esophageal, and then aortic. As far as the level is concerned, it is at the 8th vertebra, then this is T10 and this is T12. Okay. And one thing worth mentioning, that the right crus of diaphragm, this orange one, is encircling the esophagus. Okay. Now coming to the minor openings, what we are seeing, this is the from the Gephius sternum, this one slip is going on from in between the Gephius sternum and the slips which is going from the 7th costal cartilage. In between these two, this is the superior epigastric vessels and nerve. This yellow one, this is the nerve, this is the vein, and this is the artery. Superior epigastric nerve and vessels, which is the branch of the internal thoracic nerve and vessels. Okay. Now this is the musculophrenic artery in between the 7 and 8. And after that, the intercostal nerve and vessels are coming out. These are in between the two slips. These are. Now from this is the lateral arcuate ligament. You can see here from the lateral arcuate ligament, this is the subcostal nerve and vessels, and from the medial arcuate ligament, this is the sympathetic trunk. From the right crus and the left crus of the diaphragm, this is the right crus, from where superior to inferior, greater, lesser, and the least splanchnic nerve is coming out, both from the right crus and the left crus in the yellow wire, this denotes. And this blue one is the hemiazygous vein, which is only on the left crus. And the azygous vein is coming out through the aortic opening, this one. Okay. Now these are the minor openings. Okay. So we have read the origin, insertion, and the major and the minor opening. Now come to the development of the diaphragm. Diaphragm is developed from the fourth thing, that is the aspi बढ़िया. This is the principal muscle of respiration. अगर एसपी बढ़िया हो तो जीवन अच्छा हो जाता है. सुपरिटेंडेंट ऑफ पुलिस अगर अच्छा अपॉइंट हो तो रूल्स एंड रेगुलेशन रहता है, जीवन बढ़िया हो जाता है, यू नो. एंड दिस इज अ प्रिंसिपल मसल ऑफ respiration, so it will make life better. So SPBD, that is the S for septum transversum, B for SP, P for pleuroperitoneal membrane, B for body wall, D for the dorsal mesentery of esophagus. So septum transversum develop into the central tendon. This dome of diaphragm, this diaphragm, it is in the middle, it is somewhat depressed, and this is central tendon, and by the side it is somewhat everted out above superiorly. to form the right dome and the left dome of the diaphragm. So these dome of the diaphragms are developed from the pleuroperitoneal membrane, and the periphery, they are formed by the body wall, and this around the aorta, this area is formed by the dorsal around the esophagus. Around the esophagus, some part is formed by the dorsal mesentery of the esophagus. Now, what is septum transversum? Septum transversum is the cranial most mesenchyme at the 22nd day of the intrauterine life. Then, as the this is one sign in the math, that is less than. Less than is denoted by this, and more than is denoted by this. So, just like less than, that is, it is the cranial mesenchyme that just which lies above almost the cranially around the buccopharyngeal membrane at the 22nd day of the intrauterine life. Then in the neck part it descend down afterwards and going dorsally. Then at the thoracic level it comes ventrally. So like this line, that is less than. Septum transversum is at first it is a cranial mesenchyme, then it come in the cervical level but dorsally, and then come thoracic level but ventrally, from which this central tendon is derived. Okay, so this is about the development. Now coming to the relation. This from above, it is first, it is related to the endothoracic fossa. One fossa is above endothoracic fossa, and above which is lung, from both sides. Okay, just so endothoracic fossa, above that both side lung is there along with the pleura, and in the middle over the central tendon of diaphragm, this is the heart along with the serous and the fibrous pericardium. Okay, and below there is peritoneal covering. Here is the liver. Okay, liver, and then after here is the kidney, and above kidney this here is the suprarenal gland, both side kidney and suprarenal gland. Here is the liver, here is the stomach and the spleen. This is the relation over there. Okay, and above both side lung along with the pleura, in the middle heart, along with the fibrous and the serous pericardium. First heart is enclosed within the serous pericardium, and then outside it there is fibrous pericardium, and just above the diaphragm there is endothoracic fossa, which is covering all over the thoracic cavity, the structure of the thoracic cavity. So this is the relation. Now coming to the nerve supply, the diaphragm is supplied by the phrenic nerve as well as the intercostal nerve. Phrenic nerve, we all know, is the mainly coming from the ventral rami of the C4 nerve root, but it is made up of C3, C4 and C5, as it also takes the C5 division. So it is formed by the cervical plexus as well as the brachial plexus. As we all know, that is the brachial plexus is from C5 to T1, and mainly the phrenic nerve is formed by the C4, and as a whole C3, C4, C5. Okay, the ventral rami. Now it is formed there, and then it descend down along with the internal jugular vein, taking an oblique course and running down through along with the internal jugular vein. And now the phrenic nerve passes in the right side, is the lateral part of the subclavian artery, where is from the medial part of the subclavian artery. This is the right phrenic nerve and this one is the left phrenic nerve. Left medially, right laterally. Okay, and now as far as the relation with the lung is concerned, it is anterior to the lung of root. This is the phrenic nerve in yellow color. This is the phrenic nerve and this lies anterior to the lung root in the right side as well as in the left side. Here is a phrenic nerve. Okay, now it is coming downward and then the right one is along with the inferior vena cava and the left one is from the separate opening, and now it descends down and supplies the inferior surface of the diaphragm. Right and left phrenic nerve. And the intercostal nerve, we have seen they are passing from there, from the periphery. So they are giving the sensory supply. Whereas the phrenic nerve is the motor plus sensory plus sympathetic nerve. Motor, that it is giving command to the diaphragm to contract, and it receives the sensation from the diaphragm as well through its sensory fiber, as well as it's taking sensation from the diaphragmatic pleura and the mediastinal pleura as well, and the fibrous pericardium from below. Okay, from below, that is the lower part of the fibrous pericardium, obviously from the thoracic cavity in the superior level. Now these are about the nerve supply. Now coming to the arterial supply, it is supplied by the superior phrenic artery, which is the branch of the thoracic aorta, inferior phrenic artery, which is the branch of the abdominal aorta, musculophrenic artery and the pericardiophrenec artery, which are the branch of the internal thoracic artery, and then superior epigastric artery. This one is the superior epigastric artery, and this is the musculophrenic artery. All these are supplying the diaphragm. Also the intercostal arteries and the subcostal artery, all they are passing through this, so they are supplying. So this is about the arterial supply. And lymphatic drainage, there is anteriorly, there is posteriorly in the right side and the left side. Anteriorly, retroesternal lymph node is there, and in the right side, the lymphatic node around the inferior vena cava. In the left side, lymphatic node around the esophagus. In the posteriorly, lymphatic node around the aortic opening. Okay, in the posteriorly. So this is about the lymphatic drainage. Now coming to the action of the diaphragm is visu ob. The W for weightlifting. It is the muscles of the, as we all know, it is the muscles of the inspiration. We will discuss it later on. It's also is a muscle of weightlifting, that if we hold our breath then the paravertebral muscle unable to flex, the intra-abdominal pressure rises and the paravertebral muscle do not flex, then if we lift the weight, it support the diaphragm, support it in weightlifting. So it is a weightlifting muscle. And then muscle of inspiration, if the diaphragm contract, it shorten, so the intrathoracic volume rises, it becomes shortened, it descend down. So within the thoracic, the volume increases, so pressure decreases over there. And in the abdomen, as it descend down, the volume decreases, but the pressure increases. Okay, so as the muscle of inspiration, when it contract, it descend down, and the intrathoracic volume increases and thoracic pressure decreases, which create a negative pressure and pull atmospheric air inside, so help in the inspiration. Okay, now it is the muscle of straining. As it increases the intra-abdominal pressure with the contraction, it propel the food from the oral cavity, which is known as the vomiting, from the vagina, which helps in the parturition, from the urine, from the urethral opening as urine, and from the anus as the defecation. So the this muscle help in the straining procedure. Okay, and what other, it increases the venous return as the intra-abdominal pressure rises, so it propel the blood from abdomen to thorax to, so it enhances the venous return. Okay, and now what is the clinical significance of the diaphragm? The diaphragm, there is hernia, diaphragmatic hernia. It can be congenital and uh, it can be iatrogenic, traumatic, and hiatal hernia. Congenital hernia is of two types, that is the Bogdalic hernia and the Morgagni hernia. Bogdalic hernia is occur on the posterolateral aspect and mostly in the left side. 90% cases, congenital hernia, diaphragmatic hernia, is of Bogdalic type and it is very dangerous. And it mostly in the left side when abdominal content is pushed within the thoracic cavity and there is pulmonary hypertension and pulmonary hypoplasia will be there. And there will be more chances of fetal death. Okay. And second thing is the Morgagni hernia, which occur retroesternally, and this is less dangerous. Morgagni hernia, it is only in the 2% of the cases. And third one is the hiatal hernia, which is again of. Now coming to the hiatus hernia, in which the near the esophagus, the abdominal content is coming out in the thoracic cavity. And one is the traumatic hernia, another is the iatrogenic hernia. These are the clinical significance of the diaphragm. So this is all about the diaphragm. Thank you.